I would like to welcome all the members of JISHA and all the students for joining this ninth webinar on writing review of literature. And I'm grateful to Dr. Prakash Doke, who accepted our invitation for this webinar. So, uh, Dr. Prakash P. Doke is a distinguished public health expert with decades of experience in healthcare administration, research, and education. A medical doctor by training, he holds advanced qualification in public health and has made significant contributions to policymaking, epidemiology, and health system strengthening in India. Dr. Doke has served in prominent leadership roles, including as the Director of Health Sciences for the Government of Maharashtra, where he implemented innovative health programs to improve maternal and child health, immunization coverage, and communicable disease control. His efforts have had a lasting impact on public health outcomes in one of India's most populous state. An academic at heart, Dr. Doke has held positions in prestigious institutions, mentoring future public health leaders and conducting impactful research. He has authored numerous publications in peer-reviewed journals addressing critical issues such as health equity, disease surveillance, and healthcare delivery in resource-limited settings. Renowned for his strategic vision and evidence-based approach, Dr. Doke is frequently consulted by national and international organizations for his expertise. His unwavering commitment to advancing public health continues to inspire professionals across the field. I would like to welcome Dr. Doke, and we are grateful for you to accept our invitation and presenting such a crucial topic, writing a review of literature, because we really want this next generation of audiologists and speech language pathologists to be prolific in scientific writing. So thank you so much, Dr. Doke, and I hand over this session to you. Can you hear us?
Yeah. Shall I start?
Yes.
Yeah. Thank you, Nilesh, and all young participants. Maybe for about 45 to 50 minutes, we'll have session on how to write review of literature.
Just Dr. Doke, sorry to bother you. Just for all the students, we will have a question session after.
Yeah, therefore I said now, roughly
Okay,
about
fine.
45 minutes, then 10, 15 minutes, we'll have session.
Thank you. Thank you.
Basically, this discourse will primarily for dissertation or PhD post-graduation thesis writing. I have two things in my mind. I hope the participant differentiate between various types of reviews. The listeners after this presentation must be able to finalize the contents of review literature. The student and faculty after this presentation must be able to finalize style of writing review. I assume that the participants are well conversant with some reference manager. Usually we use Mendeley or Zotero or whatever it is. And they are also familiar with PubMed search. From where we get the various documents, what are the sources of literature? The most important source, of course, is books belonging to particular specialty. Next is journal articles. Third, internet search. And these are common search engines. We all know Google, Yahoo, but there are others also which are equally useful, though they are not used very frequently. Microsoft Bing, Yandex, DuckDuckGo, Baidu, Ask.com, Naver, etc. So I request participants, they can use at least 2 search engines for getting good documents of article, number of articles. I am sure you also know what is Shodha Ganga. All PhD thesis are expected to be uploaded on Shodha Ganga from all universities in India. Shodha Ganga is a treasure of information of persons who have already pursued PhD. And lastly, reports from government, universities, etc. Where we can find internet, books, etc. We will not deal much on that, but we can certainly discuss where we can find good articles. First, you must search your specialty journal. That is the basics one. One relevant article gives many cross references and usually they are relevant. Most important, use of search engines, which you have just now seen various search engines. Google Scholar, Scopus and PubMed, these are the depositories. Similar articles are suggested as well as by Mendeley and Google, and they are also really useful. I will just show. See, this is the PubMed. I searched for one article, maternal anthropometric characteristics and adverse pregnancy outcome. So after the script, Google and PubMed has suggested similar articles. You can read the articles which are given below. And if you go to these articles, I'm sure that you will find all the articles are relevant to your topic. This is about PubMed. Similarly, in Mendeley also. On the right column, you are seeing Mendeley. And the article, the first blue tick mark is the article I was asking for. But then more references, 11 more references have been detected. And usually they are the very relevant articles. The next question is, how many articles should be referred in literature review? I tell you frankly, there is no rule. Conventionally, if you are reading two articles, usually it is very likely that you will quote one of them. Again, there is thumb of rule, though it is not mandatory. About 20 articles may be cited for every 1000 words. If your review of literature is about 3000 words, you may quote 60 articles. Next aspect is when you are writing dissertation or thesis, usually we write review of literature as one of the earliest chapter. But then we must be aware about various types of reviews. There are 4 types of reviews: narrative review, scoping review, systematic review, and umbrella review. What is a narrative review? Narrative review is a type of literature review that analyzes and interprets a topic by describing and interpreting previously published writing. Usually, there is no specific question and well-defined protocol. Usually done by a single researcher, almost all dissertation and thesis are a sort of narrative review. What you are doing and what you are supposed to do is usually a narrative review. Scoping reviews are recent additions. They are useful for examining emerging evidence. When it is still unclear what other or more specific questions can be asked and valuably addressed by a more precise systematic review. So I can say that it's a earlier stage of systematic review. When there is no much evidence and you are not sure what should be the specific question, you can go for a scoping review. Scoping review, that is basically to identify various evidence in a given field, to clarify key concepts, definitions in the literature, to examine how research is conducted on a certain topic of field, to identify key characteristics of factors related to a concept, to identify and analyze knowledge gaps. Friend, this is very important. Scoping review can identify and analyze what are the existing gaps in the knowledge. And as I said, as a precursor to a systematic review. I'm sure you know what is systematic review. Systematic review connotes a different and very scientific rigor methodology. A systematic review is a review of the evidence on a clearly formulated question. For systematic review, there should be clearly formatted question. And one must use explicit methods to identify, select, and critically appraise relevant primary research. So what is the next important point? Research question and critical review of the article selected. And third stage is extraction and analysis of the data from various studies are included in this review. Systematic review is usually carried out by a team of researchers. And this is again a very recent term, umbrella review. When various systematic reviews conducted, they are having some contradictory finding, then we do what is called as umbrella review. Results of two or more systematic reviews may differ, and we have experience they may differ, although it is supposed that systematic review covers all the related documents and articles. Sometimes it happens. An umbrella review is essentially a review of reviewers. Umbrella reviews are designed to synthesize evidence from other published systematic review and or meta-analysis on a broad topic. Umbrella reviews, which are systematic reviews of previous ones, provide overall assessment of information available on a specific topic. This is not much popular, but then it will give clear guidance for formulation of guidelines. So these are the differences. This has been published by Indian Council of Medical Research. The differences between three types of reviews are very explicitly given. What is narrative review, scoping review, and systematic review? A prior review protocol is not necessary for narrative review, but for scoping reviews may or may not be. For systematic review, a prior protocol is absolutely needed. Then there is a system of registration of systematic review. There is a portal called Prospero where the researcher is supposed to register his intention to carry out a systematic review. And this is not mandatory for narrative review or scoping review, but is mandatory for systematic review. In narrative review, explicit, transparent, peer-reviewed search strategy may not exist. Scoping review, such strategy does exist, and systematic review, it certainly exists. Standardized data extraction forms are there in a systematic review and scoping review. Mandatory critical appraisal, it is not usually done in narrative review. Scoping reviews, it may or may not be done. But in systematic review, critical analysis of all the documents is obligatory for assessment of risk of bias. And then lastly, this is the synthesis of findings from individual studies and the generation of summary finding. But sometimes all systematic reviews may not progress further for meta-analysis, and few may progress for meta-analysis. When they progress for meta-analysis, we can have a conclusive combined finding. So now coming to our own discussion of writing review of literature. A good review of literature, I have compared a good review of literature and a poor literature review. A good literature review is a synthesis of available research, whereas a poor literature is a just annotated bibliography. A good review is critical evaluation. A poor review is just confined to description. Good review has appropriate breadth and depth, whereas a poor literature review is narrow and shallow. A good literature review will give a clarity and conciseness. A poor literature review may be confusing and long-winded. A good literature review uses a rigorous and consistent method. A poor literature review constructed in an arbitrary way. So our aim should be to have an excellent review literature. I'm just briefing the PubMed searching. I hope you all know it. There are three Boolean operators, and, or, and not. Nesting to group similar articles, quotes for phrases, truncation for words with multiple endings, what we call as wildcard, using filters, and what sections of articles should be searched. The same thing works in other systems also, like Scopus, Embase, Sinal, Cyclo, and Web of Sciences. And limits the number of articles, because one is interested in both the words or more words together, and hence and limits the number of articles. Whereas or increases the number of articles, as we give choices to use both the words, this or that, not together. Not decreases number of articles, but it increases certainty. So these are the common Boolean operators. And limit the number of articles because the engine search together two words, or increases the number of articles because the engine searches for both the words, and not decreases the number of articles but increases the certainty. What is nesting? To read out unnecessary articles. Write your search terms with parentheses while using Boolean operator. This is called as nesting. This is required for correct functioning of and or. Using quotes. PubMed automatically tests between two words. Instead of cell phone as a one phrase, it will search cell and phone, leading to irrelevant articles. Thus, put double quotes, quote unquote, for the concept that is cell phone. So then it will search only for cell phone together instead of cell and phone together. Use double quotes for multiple words. Truncation symbol. The PubMed truncation symbol is asterisk. The truncation uses words, stems, and matches various words endings. Minimum 4 letters are required for truncating. Like when you say child and asterisk, the engine will fetch for children, childhood, etc. Thus, it allows to search on various root words using asterisk to represent the rest of the term. It leads to the comprehensive search. Using this asterisk is called as truncation. Using filters, When you go to the website, left side you will find some use of filters. The first is year of publication. Do you want articles from human or animal studies? Are you interested in various age group? You can also select language. You can also select sex. You can also select free articles, abstract, and type of article, a review article, RCTs, etc. So this is the right, see the left side. Here you see the year, 1 year, 2 year, 5 years, what type of abstract you want, abstract, free, full text, associated data, then from what book source, clinical trials, meta-analysis, randomized trials, etc., etc. These are called as filters. And the last line is additional filters. There are additional filter also. You can go to the additional filters, and if you want, you can use them. Now, we have collected many articles from cross references, from websites, and now we are ready to read them and compile them. So normally we select the articles. Usually we go for title and abstract for selection for paper, scopus, etc. The specific word should appear in the title and the abstract. The next step is abstract. You can search only in abstract, only in title, or you can search in the full section of the article. The next issue is use of reference manager. The advantage of using reference manager is one can access online from anywhere. The selected articles are saved in a folder. It suggests good articles for reading. One can change a reference style at the tip of the finger. That's very important. When you are submitting some article to journal, although it may not be part of today's discussion, but requirement of various journals are different, and manually changing is really challenging. The sequence may change, the content may change. Therefore, use of reference manager is an excellent habit. The system downloads a referencing style repeated by journal. Even if it is not available presently or it is not getting displayed, you can download a reference style of standard journal like BMJ, Lancet, or any other. There are plenty that will give the style of referencing journal. You can cite the reference while you are typing. That is called as word plugin. Addition, deletion done at the tip of the finger. Sequence is automatically done. Out of this, EndNote is also good, but free EndNote in Word has minimum features. Mendeley and Zotero are free. I personally feel Mendeley is better, but you can use Zotero also, not a problem. What is a review of literature? A literature review discusses published information. Again, friends, remember, this is already published. You are not creating anything. Already published document you are searching in that particular area, and sometimes information in a particular subject within a certain time of period. A literature review can just be a simple summary of the sources, but it ideally should have an organizational pattern and combine both summary and synthesis. I want to stress that your review of literature should not be summary only. It should be summary and synthesis of the evidence. A summary is just a recap of the important information from the source. A synthesis is a reorganization or a reshuffling of that information. It might give a new interpretation of old material or combine new with old interpretation. Or it might trace the intellectual progression of the field, including major debates. And depending on the situation, The literature review may evaluate the sources and advise the reader on the most pertinent or relevant one. Why we should carry out review of literature? Although the format of review of literature may differ discipline to discipline, assignment-wise, several aspects are common. A review may be study itself. One can publish only, as I told, narrative review, or it may be a first step and a rationale for engaging primary research. A review is a required part of grant and research proposals and inevitably a chapter in thesis and dissertation. Generally, the purpose of review is to analyze critically a segment of published body of knowledge through summary, classification, and comparison of prior research studies, review of literatures, and theoretical articles. A literature review is the effective evaluation of selected documents on research topic. The context of research paper or thesis, the literature review is critical synthesis of previous research. The evaluation and the review literature should logically lead to research question and objectives to be used in dissertation or thesis. Again, I am repeating, all your review of literature gradually should lead to the research question and the objective. That is the beauty of writing review of literature. We call this inverted. This is like a funnel. In the review of literature, first you write about broad concept, then more relevant, and lastly narrow down, which the reader will find question in his or her mind that, oh, mostly the thesis or dissertation is related to this. Utility is really useful. It familiarizes about the facts. You will also come to know about eminent scholars, parameters of the field, and the most important, questions and hypotheses. Knowledge of various methodologies common to the field and feeling of their usefulness and appropriateness in various settings. How to proceed now? We have seen theoretical aspects. So these are the steps. First, formulate a broad topic and research question. Search literature. After searching literature, you can crystallize your or refine your topic and question. Again, search literature, analyze the documents, and present the gist. As we have seen, use reference managers. The anatomy of research question. Again, I am sure all of you know research question must have this component, Picot's format. In descriptive question, the interrogative adjectives, questions about frequencies and prevalences and incidences. Whereas in inferential question, the Picot format is population, which will be the study participants, then intervention or exposure. And when you are searching diagnostic test, it may be indexed. Comparison or gold standard, outcome, and the follow-up time within which you expect the outcome. This is called as Picot format. You must be very well versed with the Picot format. Formulating a research question, select a topic you are interested in. You want to be fascinated throughout the process and less likely to lose motivation. Unless you have chosen a topic of interest, the chances are that you will get bored if the topic is not interested. So, important and interested topic. Choose the topic which is feasible. So, I have given an example. Don't think of backaches. You must see whatever the further details. Get help from peer group. Get it early and often. Again, friends, this is sincere advice. You get help from peer group, particularly the senior ones. Solicit their opinions before you begin. Review and share the draft frequently with them. You may want to start out with a general idea, review literature of that area, and then refine your problem based upon what you have found. The next question is that was the anatomy of the research question. Now there are various criteria of research question. And I know you are aware about the criteria. They are called as finer criteria. F stands for feasibility, achievable sample size, outcomes are measurable. This is very important. Outcome should be measurable and objective. Appropriate research design guarantees adequate funding, optimizes human and technical resources, accounts for clinicians' commitment, low rates of dropout, appropriate and affordable time. These are all aspects of feasibility. Interesting, engage the interest of the investigators, attracts the attention of the readers, presents a different perspective of the problem. So reader and if you are sending for funding agency, the funder must get interest in reading your proposal. Novel, project a different aspect, generate a new finding, improves methodical flaws, resolves gaps in the existing research. These are the novelties. Ethical, of course, it should be ethical. There is no compromise. It should comply with all existing guidelines. It should safeguard the main principles of ethical. Relevance, it should be geographically relevant and it should be relevant to our discipline. The more one you learn on the subject, the more questions come to your mind. And then you may forget the things. So what is advice? Keep a list of questions or hypotheses that come to your mind or that are mentioned in what you have read. This question will help you guide when you are constructing your review. The questions will go also you in discussing the implications of your own finding and the additional research direction your work support or suggest. Evaluation, read widely. When you use your review of literature, you are actually doing two things: trying to refine your research problem and finding a gap, asking question, containing previous research, counter arguments and claiming, trying to read every source relevant to your research problem. How to read the material? I will not go into details. First, read the big picture. As we have seen the funnel, read simple and easier document first. Skim the documents and identify major concept. After 10 to 15 articles reading, you will get clear idea of your research question. Example given, groups of scientists argue or disagree with other groups. For example, some researchers think that X causes Y and other researchers think that X is only a moderating variable. And in such circumstances, the research question is very pertinent. We have already discussed narrow your topic from broad to specific. Then as you read, become more informed on the topic, think, analyze and weed out unnecessary things. Arrange this to spend some time on review time with experienced researcher or your guide or some expert and get frequent feedback, particularly about your problems. This is first you must read the abstract and decide, is this article useful in my review of literature? If you feel it is useful, then read thoroughly the full article. Then read the introduction. Try, is the article is giving the relevant aspect what you think of? Read methods. Are your methods and methodologies similar? Evaluate results. Do the conclusions seems logical? Many times what happens, the article draws conclusion which are not discussed in the results. So you have to evaluate it. Can you detect any bias on the part of researcher? It may not be exactly the assessment of bias, but then usually, although not systematic, you must look in general. Take the discussion or conclusion with a grain of salt. Edges are smoothed out. Pay attention to the limitations. And if possible, you can include the articles where the earlier articles has mentioned limitations. That will give you a broad idea. Analyze the literature. Takes note as you read in a manner that will be included in your review. How we can take the notes? Study year and location. Where the study was carried out, in which year the study was carried out, what was the main purpose of the study, synopsis, what was the research design used in the study, and brief review of important finding, including the number of participants. I suggest you can use an Excel sheet having all these columns. That becomes very easy for review of literature. You can review when the columns are there and it is in Excel. You can change as per the chronological order. You can study area-wise differences. You can study research design-wise differences. So my advice is that take your notes on an Excel sheet. As you organize your review, integrate findings elicited from note-taking on table of making process. Construct a review of literature. I have to now see how to organize it. You have to see what was the conclusion of authors, what was the specific purpose, what were the objectives, and chronology. You can group this, summarize the individual studies of an article when you are writing in the words. The number of words you have taken from the article denotes the significance. More notes you have taken, which means that significant is the author, the article. If you don't feel the article is very significant, you will write only few words. So your length of note denotes the significance. Don't need to provide a lot of details about the procedures used in other studies. Most literature reviews only describe the main findings, relevant methodological issues, and major conclusion of the other research. Discuss major areas of agreement and disagreement. I request you both discuss what are the major areas of agreement and what are the major areas of disagreement. Tie the study into current body of literature, make logical interpretation. If there is no discussion of the relevance of the overview to other work in the field, or if there is no interpretation of the literature, it may signal that author has not thoroughly investigated the topic. When the reader or examiner read it, or the reviewer of the article reads it, he will say that the author has not done the work properly. What should be the contents of review? Review of literature. Comparison across studies. That is the most important and core. We will go into detail later. But the core component of review of literature is a comparison across the studies. Key points for review may concern areas of similarities and dissimilarity. As we have stated, we have to discuss on similarities and agreement. First, few paragraphs should be about introduction to the literature review, what has been done, how we have written the review of literature, and the thing which is written in italic, very important. You have to clearly mention that this is not was the scope of my study. You cannot write down everything available on the earth. So clearly write beyond the scope of my boundaries. We have done this much only. Section 1, the most important topic of our key concept discussed and evaluated and summarized and related to your research topic. Section 2, the next most important topic or the key concept discussed, evaluated and summarized any additional section following similar pattern. Then conclusion. From each of the sections summarizes, highlight the most relevant points, relate this back to the need of the research, reiterate what this means for research design. An ideal review of literature, place each work in the context of its contribution to the understanding, describe the relation of each work to each other, identifies new ways to interpret, and shed light on any gaps of previous research, resolves conflicts among seemingly contradictory previous studies, identifies areas prior scholarship to prevent duplication of effort, point the way forward for further research. Again, very important, somewhere at the end of the review of literature, you must point out where can be further research. Places original work in case of thesis or dissertation in the context of existing literature. Be accurate and thorough. That is again important. You should be, your review acts as guide for your topics of other. Take care that you are accurate. The citations are correct. The findings are correct. Attributed to the correct author. Reference style is correct and consistent. Make sure someone can track down the article and then you have provided a reliable presentation, complete, include most important papers, and I have underline and make it bold. In the review of literature, each and every paper may not be included. That will be included in a systematic review, not individual review of literature. So most important references. Research summary tips, use understand the research engine system to find key databases, consult with librarian, talk to experienced researchers, look at various completed dissertations, and collecting reference use systems. How to present? Again, friends, I have seen many review of literature. They just cut paste abstract from published article and write down in the sequence. Therefore, I have said that no copy pasting. You should write in your own words. One by one articles, chronological sequence, that's okay method. By methodology also you can write like cohort studies, case control studies, etc. Or theme wise and subsection wise. Probably out of all this is the best system. Theme wise or aspect wise, you should write your review of literature. So these are the few examples. In this example, the person has reviewed literature, just author and one small paragraph. One after other. There is no sequence between first and second article. So just he goes on writing and compiling. So this is preferred. As I said, first he has taken some concept, risk of factors for low birth weight women. He has quoted some references that made important finding. Then second aspect, BMI. Third aspect, unintended pregnancy. That should be the best way of representing. But in one section, you can have the references arranged chronologically or arranged by importance wise, even in this risk for factors for low birth weight baby or BMI. So as I said, these are the three types of presentation: chronological order, thematic, and methodological. I think we can skip. We have seen something about why review of literature is necessary. structure we have seen, the introduction, the body, the conclusion, and lastly, the recommendation. What you should write, that's again a checklist. Have I fulfilled the purpose of literature review? Ask this question to yourself. And if you are satisfied, go ahead. Is it written at a level appropriate to its audience? Are its facts correct? The mentioned facts are correct. Is all the information included is relevant? Are the layout and presentation easy to the eye? Is the language clear, concise, and academic? Does the abstract summarizes the entire review? Does the introduction adequately introduces the topic? Is the body organized logically? Does the conclusion interpret, analyze, and evaluate? Are the recommendations reasonable? Does the table of contents correspond with the actual contents? Are page numbers correct? Have I acknowledged all sources of information through correct referencing? Have I checked spelling, grammar, and punctuation? Have I carefully proofread the final draft? Answer to all checklist questions should be yes. Then and then only your review of literature is good. What are the common pitfalls? In many years, I have seen these are the very common pitfalls. Vagueness due to or too much inappropriate generalization. Limited range, you are not having comprehensive review. Insufficient information. And most important, many review of literature just bulky without any relevant material. Omission of contrasting reviews. Those reviews which are not matching with your objectives, many people omit them. And omission of recent work. Because the student have started before 2-3 years and latest recent information articles are many times missed. So if any queries, I think we can discuss your queries.
Thank you so
Yes,
much, Dr.
Nilesh?
Thank you so much, Dr. Doke.
Yeah.
It was very insightful, and I'm very sure this presentation will be very useful for all our students. Dear students, please type your questions in the chat box, and then we'll discuss your questions. And there is a feedback form that you are required to complete it, and there is a link already pasted in the chat box. So please you refer that link to complete the feedback form after the end of this presentation. Please type your questions in the chat box. Dr. Doke, it was very comprehensive presentation. You have covered all the important uh, aspects of literature review, fundamentals, and I think this is something that is very critical for graduate students in audiology and speech language pathology. Thank you so much.
Shall I stop sharing?
Yes. Yeah. So Dr. Gore said that Boolean messages info was very good. There's a question from Shalmali Das, and she's saying, good morning, sir. Sir, I have a question regarding if we have a very limited articles available for review of literature, or in case we are doing research on a very new topic, then what will be the protocol for referencing the review of literature?
Yeah. Usually the best solution is search more and more engines. Because if you are searching only one engine, you will get limited articles. My advice will be if you are feeling that the articles are not adequate, probably your search is not extensive. And it's very unlikely that there won't be many articles. So go to various search articles, at least do minimum 2 or 3 languages. In the Google, then PubMed, you have a choice. You don't restrict any languages. You will get some very good articles from German, Spanish, because these are the languages which are spoken next to English. And then you can translate to the Google abstract, you can translate. And for results, I think the tables, you can read the figures, numerical figures are English. So you can consider such type of search. More search engines, Scopus, PubMed, or maybe go to other engines. So try to include as much as possible. But there is, as I said, there is no rule how many should be included. I told you the general rule. So are you satisfied? You have to search more for getting articles. These are mostly postgraduate students or faculty too. I have no idea.
There are faculty members and graduate students.
Okay, okay,
And I think there are some undergraduate students also.
okay, okay.
So Ajay Kumar asked, what's your view on AI in review of literature?
So I was expecting such question. In fact, this has become easy for students. But then I advise you surely make use of it, but don't copy paste it. It will give nice ideas. Use these ideas and write in your own words. That's an excellent. It's a think as an excellent help, not as a replacement. And therefore, many journals now they ask you have to mention I have used AI or not use AI. One thing, and also in AI they can check the plagiarism. So the advice is that read thoroughly what has been generated by AI, make use of it, and write in your own words. But I suggest that it gives nice idea. But my suggestion to all participants is you get acquainted with search engines. PubMed is the excellent Scopus and the PubMed. If you are familiar with these two, you can get plenty of articles. And secondly, use of your reference manager system. You must be
Mhm.
master in using that. That
Yeah.
solves your many problems of writing and referencing.
And I think even there are videos on YouTube on how to use Zotero and
Yes,
Mendeley.
yes, there are.
So
There are
please
good
refer to those
videos.
videos. Yeah.
But more than seeing videos, you have to practice it.
Yes,
When you see
exactly.
video, you feel that it is very easy. I have understood. But when you try it, you find the difficulties. Or you may not find, oh, I don't know it. So frequently use it. By using, you become master. And then for PubMed, there are tutorials also. The
Yeah.
PubMed itself gives tutorials.
Mhm.
Go through the tutorials.
And you can find all the reference styles in that. You just need to explore.
Yes.
There are some saved by default, and there's some that you can download and install on that software, either Mendeley or Zotero. So it's not like if there is one that you can't see, but it's the softwares are open and you can easily install those styles into the software. Any other
Nilesh,
questions?
yeah.
Yes.
If there are no further questions, you may close down.
Okay. Any questions? Last or okay. I would like to thank Dr. Doke for giving your valuable time to present on such an important topic. And we all really learned a lot, not just for students, but even for the faculty members like me. It was very insightful. And I would also like to thank the President and Secretary of Indian Speech and Hearing Association and Editor-in-Chief, Dr. Pinki Singh, for organizing this 9th webinar on this crucial topic of how to write literature review. So thank you so much. And Dr.
Thank
Doke,
you.
thank
Dr.
you so
Pinki
much
Singh
for.
always chases.
Mhm. Yes.
Thank you very much, sir, for your nice presentation, sir.
Okay then. Okay. Thank you.
Thank you.
It was a pleasure to have interaction.
Mhm. Thank you so much. Really appreciate. And dear students, please use that feedback form link and complete the feedback. It will help us to make webinars better, and that could be done only through feedback from students. The link of that feedback form is given in the chat box. Please refer